to today's webinar hosted by Edgenta NXT. My name is Nasha, currently working with UEM Edgenta as a fresh graduate trainee under Business Development Department. Joining us today's webinar is Dr. Nurul Solihin, our resident doctor here in UEM Edgenta, as well as the project lead for our private CAC here in Edgenta UELC. Here are some of his background. He graduated with medical degree from Universitas Hasanuddin, Indonesia on 2017. He was a medical officer for 3 years at Hospital Putrajaya. On March 2020, he joined Selangor Task Force COVID-19 for 1 year. Then he worked with Artificial Intelligence for Medical Epidemiology, AIME, for 4 months. On July 2021, he joined UEM Edgenta as an assistant manager for business development clinical department. So before we get started, I'd like to go over a few items so you know how to participate in our webinar today. Throughout this webinar, your mic will be disabled. However, if you have any questions during the session, please type them into the chat box. We will collect them and address during the Q&A session at the end of today's presentation. Just a bit introduction of our center here. Our private COVID-19 assessment center here in UEM Edgenta Learning Center is the country's first private CAC which can accommodate 500 patients daily. Our facility here provides a full suite of screening services, including COVID-19 assessment, home quarantine program, quarantine release order, and drive-through swab tests, as well as walk-in screening tests. COVID-19 patients will be assessed before they are sent to hospitals, COVID-19 quarantine and treatment centers, or undergo quarantine at home. Now, to show you around our private CAC, we will go over to Dr. Solihin, who is on site at our drive-through COVID-19 screening site to give you a tour of our facilities and services. Doctor, over to you.
All right. Okay. Assalamualaikum.
All right.
Right. Good evening. And also, wait, hang on, motorbike is coming through. So that's not part of the webinar, but it's okay. All right, so welcome again to our UELC Learning Center, UM Learning Center, which is now has been turned into our very own private CAC in Petaling Jaya. So now I'm just showing you behind me is the COVID-19 drive-through booth where we do our drive-through screening. Okay, so we'll have a short walkthrough. All right, so okay, before we go into the booth, just behind me is actually the entrance to our private COVID assessment center. Of course, we can't go in; it's only for positive patients. But this is our center, which Nasha has mentioned before. It's the first in Malaysia, the first private CAC. Right? Okay, let's go inside. All right, we are entering the COVID-19 screening booth. Okay, if you come inside here by your vehicle, your car, you do not need to get down in the car. Just turn down your windshield or your window, and you can scan your MySejahtera, and also you can scan on your payment options. Of course, we suggest for cashless transaction. Okay, and also you can see the price. This is very reasonable. Okay, let's say hi to some of our team here. Okay. Max and also, Max and Shauki, and of course they are doing their screening as well as processing of the samples. Okay, all right. Okay, let's go. Now we are going walking to our mobile lab, which is just situated right behind our CAC.
All right, thank you, Doctor, for the tour. Ladies and gentlemen, our drive-through screening facility is located right in the heart of Petaling Jaya on Jalan Templar. You can find us on Google Maps or Waze by searching Private CAC UELC. As Dr. Solihin had shown just now, we offer both PCR and RTK tests at reasonable rates. Our RTK screenings and can deliver quick results in approximately 30 minutes, while the PCR screenings deliver comprehensive and accurate results within 24 to 48 hours. Next, Dr. Solihin will be showing you our mobile lab, also known as Mobile On-Site Testing Facility, which is MOSFAC. This mobile lab is an initiative by Edgenta to assist the government in ramping up PCR testing by deploying mobile facilities that enables quick detection of COVID-19, as well as in the management of HQMS via the RFID bracelets. Dr. Solihin, so can you tell us more about this mobile lab?
Hi, all right. So I think Nasha has covered most of the information about the mobile app. Okay, so basically, you can see why it's called a mobile app because it can be transported anywhere we want. Okay, so this is also to help the government to do a lot more testing and screening and to manage COVID-19 patients accordingly. Okay, so the capacity is around 3,300 tests per day, so that should be sufficient to assist on the effort. Okay, so I think that's about it for me. I'll go back over inside to continue the webinar.
All right, thank you, Dr. Solihin. Ladies and gentlemen, so that was a tour of our facilities here in our private CAC. Early detection and treatment of COVID-19 can reduce mortality rate. So if you are experiencing any symptoms or you had come in close contact with any COVID-19 patients, please do get tested immediately. Now moving on to our webinar topic on transition from pandemic to endemic. What do you need to know? Ladies and gentlemen, just a gentle reminder, please feel free to submit questions through the chat box anytime during the session. We will have a Q&A session at the end of the session where Dr. Solihin will address your questions posted. As per announced by our Health Minister, Khairy Jamaluddin, that we Malaysian people need to accept the fact that maybe endpoint of this COVID-19 situation is endemic. I believe most of us still have a doubt. What will be the new normal? Is it for a short-term measure or long-term measure? And here we have Dr. Solihin to give us the answer. Are you okay, Doctor?
Yeah. Sorry. Hi, hello. Hi, hello. All right, I'm back. Okay. All right. So I think Nasha has explained excellently about us transitioning into the endemic state from pandemic. Okay. So basically, the question is, what will be the new normal from now onwards? Okay. For me, as the non-pharmacological approach, I think the mask mandate will continue at least for at least the short term in public places. Okay, I don't think we can run off from that, to be honest. Okay, because COVID-19 is still new. I mean, it's relatively around 2 years old, and we do not know so much about SARS-CoV-2, which is the initial name. Now we call it COVID-19. So whatever we know, whatever we learned from last year, and we predicted, but it's totally different this year. There is still a lot of unknown and a lot of uncertainties. So therefore, we still need to be flexible and open-minded, and we cannot afford to reject some of the possibilities that the virus can throw at us. So we need to be adaptable and be ready to change, of course, whenever we require to. It's not about matter of right or wrong, but I think we need to have a target. What do we want to achieve in this current situation? We cannot keep holding or keep on wanting to hold on to the preset planning we have. Along the way, things will change, and we just need to adapt and evolve, just like the virus and how it's affecting our life. Yep.
All right. Thank you, Doctor. The latest percentage of Malaysians adult population vaccination rate as of 29 September 2021, fully vaccinated is 0.7%, and at least one dose vaccination is 94.1%. And as we know, the adolescent vaccination is ongoing. All right, Dr. Solihin, based on this percentage, when we will reach herd immunity, why herd immunity has not kicked in? We have reached more than 80% adult vaccination, but the cases in Malaysia are still high, which today is more than 10K cases, and the number of deaths still also high.
Okay, all right. So herd immunity. Okay, so basically we have heard about this for quite some times, where we are known to have, if you are known to have more than 80% of adult vaccinations, herd immunity will come to play. But it all depends on the transmissibility of the virus, or what we call the R naught. Okay, so R naught basically means that how many people one infected people case can pass on an average. Okay, so the current R naught in Malaysia is around 0.89, if I'm not mistaken, the latest one. Early August it was above 1, so basically it's going down the trend now, right? But in saying this, it's essential to vaccinate a far larger proportion to be able to reach the herd immunity. Even if the vaccine is 100% efficacy, which none of the vaccines are at the moment, even Pfizer is around 90%, we still need to vaccinate a larger far proportion, more than 80%. In saying that, if we can even get 100% population vaccinated, there will still be ongoing transmission of the virus. It does not mean that COVID-19 will disappear completely. All right. But also, I'm not saying that vaccination is not good. Don't get me wrong. Okay, vaccination will solve a lot of problem. All the disease will be only mild disease, and it will cut down transmission remarkably. But of course, to get to 100% vaccination is where the challenge is truly is. And also it depends on where we want to set the threshold. You asked earlier about endemicity. Okay, so the true answer is no one actually knows what is the benchmark or the threshold. It also depends on the society itself. We need to set an expectation, and basically that is our endemicity. What price are we willing to pay to accept the number of people that has been infected? So I think in summary, the herd immunity that as we understand it before theoretically, maybe is not relevant now. We should learn to live with it, we should study it, and we should prepare for new challenges.
Right. Okay, doctor. After we have reached the herd immunity, which we will go to the endemic, what should we expect? How many death counts? How many infection numbers?
All right. So in an endemic situation, okay, or this will also tie up with the earlier question regarding the new normal, okay. So let's take Denmark as an example, where they have loosened or they have opened up all their restrictive measures, okay. But then there are cases, and the cases are rising as we speak, okay. So this is where we need to find a balance between public health, living back to our normal life or close to it, and also taking care of all the society constraints and also restrictive measures. One thing that we are not looking into is basically the effect on the society while we are doing all these lockdowns and also restrictive measures. What happens to our mental health of the people who are staying at home, who are losing their jobs? How about the future of our children going to school? Like, how are these children going to shape up in the future to become our future leaders? And also university students stuck at home. So all these factors have to be measured out. Uh, Also, we need to take account of the death count and also the infection numbers. So these two factors needs to be balanced out in order for us to step into the endemic state, or what we call it the new normal as it is.
Right, that's a good answer. All right, doctor. As we know, around 19 September, the government has set an early October target to roll out a third dose of COVID-19 vaccine booster shot for vulnerable groups. According to Health Minister Khairy Jamaluddin, is the booster shot necessary for everyone or it is just for the non-immunocompromised? And also, can we mix up with other brands? For example, my first and second dose are AstraZeneca, and for the booster dose, I will get the Pfizer. Is it possible, doctor?
Okay, so before I answer this question, a bit of disclaimer. I'm not talking on behalf of Ministry of Health or any particular expertise. Okay, this is just from my experience. All right, so of course we have heard about the third booster shot. Okay, so it is supposedly mainly for the immunocompromised and also the frontliners who are at risk of getting COVID-19 despite getting a full dose. Okay, so as the research states that, sorry, hello, I'm all right. Okay, all right, sorry. So sorry about that. Okay, so I'll just repeat back, is it? So for the third booster, I'm not speaking on behalf of Ministry of Health or any sort of expertise, immunologist or anything, but it's just mainly my opinion and also from my experience. So for the third booster, we all know that it is mainly for the immunocompromised as well as the frontliners who are at high risk of getting COVID-19 despite their full dose or their complete dose. Right. So based on the latest article or research, it is significant for vulnerable groups and also immunocompromised. And hence, why is it mainly for them? But the ability of vaccines to stop COVID-19, the current dose vaccines from stopping COVID-19 from progressing to severe disease is still good. Our previous knowledge is that vaccines are meant to stop or decrease transmission of COVID, but the Delta variant changes the landscape. So a bit of just a rough explanation on how the vaccine works or the immune system works. When our body reacts to the virus, it reacts in the form of a memory. Okay, so when we see the virus, it will take around a couple of days, 2 to 3 days before we can react to it. So here is where we are playing the chasing game with the Delta variant. Okay, so if the immune system catches up first, it will stop the disease. So if the Delta variants wins first, and then we'll progress into the disease. Okay, so we can win at the back end. You can stop it from getting serious or getting to be severe. But on the front end is where the progress is still there to improve the vaccine. So at the moment, for normal individuals, the 2 doses are sufficient to say the least. But in the future, we may need to add on the third booster for everyone. Okay, why is it not significant at the moment? Even the double dose vaccine, for example, Pfizer has already 90% efficacy. So no study has shown that mixing up another type of vaccine, for example, a Pfizer, 2 doses of Pfizer and one of Sinovac, it's better. All right, unless there is a new variant vaccine which will be rolled out, it's currently under clinical trials, then probably that is a different ball game lah. Probably is more feasible and ideal. So yes, booster shots may be required annually, but at the moment the two shots is sufficient to stop from progressing to severe disease.
All right, doctor. Thank you for your sharing. Let's take a few questions from our guest today. We read a few questions here. We got about 3 questions. I will read the first one from A. Halim Muhammad Kari. What is the cost for us UAM staff to do PCR test for 24-hour result? This for entry requirement to Sarawak, and I believe Encik Halim is one of UAM staff. Alright, Doctor.
Okay, at the moment, I don't really have the answer for UM staff, but I think we can work it out of some sort of a discount for UM Magenta staff. I think that can be worked out. Yep, we have not come out with the package yet. So at the moment, the COVID-19 drive-through is still at 230 ringgit for PCR. But of course, we are looking into the price to become more reasonable and competitive with the current situation. But yes, of course, we can work something out for you, Magenta staff. Thank you for that.
Okay, we go to the next question from Mr. Govindan. Why people get infected even they had vaccinated? What went wrong? Alright, Doctor.
All right, good question. Okay, so I think I've just touched this a bit on my explanation. So, number one, it depends on the transmissibility of the virus, because at the moment the virus is not the same as the ones that we studied last year. For example, we have new variants, Delta and Lambda. So the vaccine is, number two is the vaccine itself. It only represents part of the virus. Only part of the virus are introduced to our body to form a memory to fight the virus. So that's why the efficacy is not 100%. It's only 90% at max for Pfizer. Other brands differ. So there are still percentages that we could get infected despite getting full double dose or complete dose. So yes, vaccines do not mean that you are 100% immune to the COVID-19 situation, just like other vaccines that we have been given while we are a toddler or we are a baby. So we are still have the vulnerability to be infected depending on the vaccines itself, the efficacy of the vaccines, and also our immune body.
Alright, a good answer. Hope you will answer the question to Mr. Govindan. Alright, we will go to the next question from Mrs. Jamaliah Muhammad Sharif. What factors shape the transition to endemicity? Yep.
Sorry, can you repeat the question?
Alright. What factors shape the transition to endemicity?
All right, I think I've touched on this a bit as well. Okay, so at the moment, it is up to us, up to the government to set a threshold. When do we decide to go into endemicity? So how are we willing to accept the cases per day or the death per day? So if you're willing to accept the current number, which is 10,000 plus per day as an endemic, then yes, that is our benchmark. But it differs from society to another society. So there is no right or wrong, and there is no one cut-off point to enter an endemic. Because number one, this virus is new. Number two, it differs from society. Some society, they want to become free faster. For example, the Europeans, the United States people, they want to become free faster despite the cases are still up. So a certain societies, they can still remain in constrictive measures, and as long as the numbers go down. So endemicity is actually a very philosophical thing, and we need to decide what is the cutoff point. We meaning the Ministry of Health lah, not me lah. Okay, all right.
All right. Thank you, Doctor. I believe it will answer your question to Miss Jamalia. All right, to the next question from Dr. Said Zaman. How do you see the ease of restrictions such as non-compulsory wearing masks in public places, gatherings, doable in Malaysia as what it is in being practiced currently in UK? Right.
Okay, lovely questions, Dr. Sai. All right, so as I mentioned before, um, it differs from society to society, and how are we willing to accept the number of cases. So in the UK, yes, they have pulled down the mask mandate, okay, and stadiums are filled up with crowds, and all the cafes are filled up, they are not wearing masks. Okay, yes, that is doable, but are we able to accept the fact that if suddenly there are rises in cases, and are we able to deal with it? So NHS may be able to be ready to deal with it, but I think MOH is not ready for it. So once we are ready for it, maybe we can pull down the mask mandate. So it is up to the local government or the local organization or society to decide whether such mandate is bearable for us. Okay, wearing a mask, not wearing a mask is a choice that we have to make. Even if they say mask mandate is off, I think majority of us will still wear a mask. Yep.
Yep, I also agree. And for the last question from Ms. Jamalia Muhammad Sharif also, how does the transition from pandemic to endemic will look like? How will it affect us solely?
Okay, so basically, let's put it like this. Okay, if we are to accept that this is an endemic, okay, just like what our Minister of Health is saying in some of his press conferences, we need to learn to live with COVID-19, meaning that COVID-19 will be like one of those common flu that we have. Okay, but of course the transmissibility rate is higher than common flu, but it is how we manage the flu. How are we going to cope with such amount of infectious? And this is also done in several countries now, where they treat COVID-19 just like a normal flu. If you have it, just stay at home, isolate yourself, and then you will recover by your own. Okay, but how are we prepared to do that? How are our people disciplined to stay at home and also isolate themselves? Once we get to that level, maybe we can accept this and as an endemic, and we can all live with COVID-19 as if it's just a normal flu. Back in pre-COVID era, if someone has a flu, you would just like not go close with him. So the same things go to COVID-19 as well. If someone has COVID-19, maybe we should not see him. So yeah, that will affect our life in that sense.
All right, I think that's all. We have already covered all the question. But is there any question? Can you guys can find Dr. Solihin at CAC? Can Doctor?
Inshallah.
All right. I Okay, ladies and gentlemen, we have come to the end of our webinar today. We hope after today's session, you will be more confident and better prepared to live in the new normal. Just before we end our session today, can I request that you turn on your camera and let's have a group of photo. Okay. Let's go turn on your camera there. Let's have a photo, selfie. Yay! All right. Okay.
Thank you, everyone.
All right. Thank you everyone. On behalf of the team in Edgenta NXT and Private CSC at ULC, thank you for joining us today and have a great weekend ahead. Bye. Thank you. Stay safe.